Well, the key thing of our practice is I see every patient that walks in that door. To me, that's important, especially as a surgeon, because I like to read the patient, listen to the patient, and see what the needs of each patient is. And at the end of the day, I want to see if I can match the needs of that
Right.
patient. If I can't, then it's not worth me pursuing, let's say, surgery. Some patients I get and I say, you know what, stick with your glasses. It's a better option than doing surgery. But the only way I can do that is if I look eye to eye. Right, and it's both. It's a party both ways. So the patient's looking at me and maybe judging me. Maybe he doesn't like my tie and goes somewhere else. So it's a two-way street.
Well, that's tremendous that you see every patient in your practice.
Yes, and also you walk them through. And I found out that patients are very reasonable. If you go through the risks of everybody, and some people might have added risks, and I kind of sit down and go through all those. And if they do experience them, they understand and they work with it. And ultimately, at the end of the day, it gets resolved and they're happy.
And not every procedure is suitable for everyone.
No, not every procedure isn't.
Okay, we're taking your calls at 404-872-0750. Dr. Ashraf is taking your calls. If you have maybe an eye problem that you've been suffering with, that maybe you've been thinking about having surgery, but you don't know if you're a candidate or you're a little hesitant, well, this is the time to talk to a doctor and have those concerns met and get those questions answered at 404-872-0750. That's 404-872-0750. Or maybe you had LASIK years and years ago and want to know if there's another procedure out there for you at this late stage in life. Dr. Ashraf can answer those questions for you at 404-872-0750. And is there cutting edge technology and personalized care that you attach to each individual patient that walks through the door?
Yeah, so let's go over, I see all kinds of patients, different ages, but let's say a typical patient coming in asking about laser vision correction, right? So I tell every one of them that you can continue wearing your glasses. You can continue wearing contact lenses if they're wearing them already. Or there's the option of laser vision correction, and we go through the pluses and minuses, right? Now, the first two choices, they've already went through it. They already are over it, and they already know that. But I have to offer them and reiterate that to them. Because all these are surgeries, right? Even though they're safe,
it's surgery.
It is still surgery. It's like driving a car. Yes, we like to go to Kroger, but you don't know. Especially in Atlanta, somebody might run that red light, and you may end up in Grady.
Right.
There's not a 0% chance, but the chance is there.
Absolutely.
So I just want to make sure that patients understand that, and most people do.